The broadcast is now starting. All attendees are in listen-only mode.
All right, is everyone here? It is Wednesday afternoon, and we are ready for Recruitment Bootcamp week number 5. We are excited that you're here today, and today we get to talk about these exciting projects of priorities and budgeting, which are two very, very important aspects of the Recruitment Bootcamp. So, before we get started, though, I want to let you know, one, we are recording. And additionally to recording this week, we recorded last week. So if you go to the discussion board on chcworkforce.org and under week number 3, if you actually go to the webinar, there's 2 sections, and we'll talk about that a little bit later. But click on the webinar part under week number 3, and there is a YouTube video that Suzanne put up, and so you can watch last week's session on community planning on week 3. So make sure you do that. Also, ask questions. And today we're probably going to give you a little bit of time at the end to just have a little discussion with us. And we have a couple poll questions built in today also to keep it a little more interactive. But please feel free to ask questions. That's what we're here for. That's how we all learn. We share ideas. We get suggestions, and we challenge ourselves. And some of the practices that maybe we've used for years and years and years, maybe we'll get some new ideas and new suggestions. So make sure you ask questions. And most importantly today is enjoy the webinar, have fun, learn something. And so we try to make it entertaining. And if you've ever had me as a presenter, that can sometimes happen because I can sometimes go off topic a little bit. But anyway, so today, you have myself, Ann Hogan. I have my own company called Ann Hogan Consulting, but I also have done about 20 years in a community health center. And we had rural sites, urban sites, kind of everything in between, encompassing many thousands of square miles. And I've recruited physicians, dentists, PAs, etc., everything we're talking about today. So be sure to ask questions of any of the faculty, and that is Allison, Mariah, myself, and Suzanne Spear. And between all of us, we have a lot of experience in many different areas. And so be sure to access us through our emails or also through the discussion board. That's great too. Or feel free to give us a call. All of our phone numbers are there. So really, if you have questions or you're stuck on something or you feel like, I want to bounce this idea off someone else, be sure to do that. That's what we're here for. So I want to review our goals before we get started. And that is the bootcamp goals that go for all 12 weeks, right? So we are here to not only build a strategy, a recruitment strategy, and that's exactly what it is. And I know I was in HR for a long time. And years ago, workforce was not necessarily a strategy. It was a necessity of something that you did. It has truly shifted. So it is really a workforce strategy. Just like you have your strategic plan for your organization, you also need a workforce strategy. So when we think about that, we're thinking about all the different aspects of the recruitment bootcamp to bring you success in the end with your recruitment. So as we build on the bootcamp, that's exactly what you're doing. You're building that strategy for your workforce. The second one is building relationships. Now, all of you are on here today. There's many participants, and there's a total of 25 people in this bootcamp. And I really, really suggest that you connect not only on the discussion board, but also through LinkedIn. If you share each other's emails, start forming relationships with each other so that you can learn from each other, share ideas that work, share challenges when the bootcamp is done. It's a great way to build those relationships and build a network. And sometimes those of us that do this role, whether you're in HR or you're in medical or you're the COO or the CEO of a smaller health center that's participating in this recruitment bootcamp. That's what it's about. It's about building relationships. And you don't always have to go to some big fancy conference to do that. So make sure you're connecting, again, on LinkedIn, on the discussion board, etc. And then we're also here to build processes. And as we know, processes, if we follow the process, a lot of times we have much more success than if we just kind of throw ideas out there and shotgun the approach, right? So we want to build processes in the boot camp that'll not ensure success, and we would love to say that it will, but it certainly will improve your chances significantly if we have processes in place. But before we go further, I want to go to last week's recap. We discussed community plans and also who's on your recruitment team. So when you look at your community plan, do you have a plan with that regard to community? So are you engaging with not only schools and residencies and your PCA, but are you also engaging with your hospitals, maybe other providers in the area? If you're in a large enough area, maybe there's other specialists in the area that you can connect with. So are you really building that plan? Again, the community plan is also part of networking. So make sure that you're getting in touch with all of those different players. And when I say community, I know some of you are in a very, very small community, and you might be the only provider in town. But there's still the larger state. There's the larger county. Are you involved with your county services? Are you letting people know that you're recruiting someone into your area? And are you utilizing what value they bring when you're in that recruiting process? Or even after you've recruited someone into your community, are you allowing them to participate to welcome that new provider into the area? So think about those things and how you're utilizing that community plan. And also the need for collaboration. Again, it's a collaborative effort to bring a provider into the area, whether it's a small town, large town, urban town. I know we talked to someone last week during office hours that was in LA. We also spoke to someone who was in Oklahoma in a much more rural area. And actually the two of them had very, very similar issues. And so you have to think about the urban area of LA, very, very populated, has a lot to offer, versus Oklahoma, very rural area, but has very different things to offer also. So again, the need to collaborate with those people in your community is priceless. So make sure you're letting everyone in your community know that you're looking for a provider, because again, you never know who knows who, right? And also you're collaborating with that PCA in your state. They are there to help with workforce issues. They're there to help with your needs assessments. They're there to help with a variety of different trainings and ideas. So make sure that you're accessing them. Additionally, we have a specialist here on our faculty that just came from working for a PCA. So if you have any questions about what PCAs do for you, make sure you contact Suzanne, because she knows. She just left the PCA. So think about that. Think about your hospital. Think about your school. Think about residency programs. You know, get in touch with people, because as you meet for coffee or you just have a phone call with them, make sure that you're letting them know what you're trying to do and listen to their ideas for different improvements maybe to your recruitment plan, or what challenges they're facing, and maybe you can help them. So it's very important to collaborate with those in your community. And then look at who's part of your recruitment team. So who is part of the recruitment team? Is it just you there? Well, then you also need to include medical. Maybe you need to include other providers. You need to include your support staff. You need to include your community members, your board members. Again, all of these people together, you have a much better chance of success getting that provider that's a good fit for your organization. So think about who is part of that recruitment team as you move forward. Now, the discussion board. I want to hit on the discussion board a little bit because it has been used by several of you, but we really want to see it expand so it's used by everybody. So I want to make sure that you all know how to get to the discussion board. And if you don't have a sign-in, you can click you don't have a sign-in, or Mariah can certainly help you with that. But if you don't have one, they'll send you an email and you set it up just like anything else. So once you're into the discussion board, there's drop downs, and there's under each week there's like 3 or 4 different drop downs. One is webinars, one's discussion board, one's just information. So there's some information about credentialing and things like that are in there also. And you do have to go through each week. But for instance, if you go to the discussion board and click on the right-hand side, the 2017 recruitment discussion board, recruitment bootcamp group, you select the relevant week. So say you go to week number 3, which was 2 weeks ago, and go to Suzanne's post, and you'll go to the YouTube. But there's also places there to comment and reply, which is under the little tab that says discussion board. So once you're in there, several people have brought up some questions, and we'll go through those in a minute as to kind of what people are talking about on the discussion board. But be sure to comment and reply to others if you're having the same challenge. Or if you see their challenge and you think, wow, maybe this is an idea for them, go ahead and reply. So make sure that you're utilizing the tools that are here, because that'll make us all much more successful. And to be realistic, we're all really, really good, right? Everybody on this webinar is really good at what we do, but we all can learn from each other, and we can all share different ideas of what maybe worked or what maybe didn't work, or how we can tweak something. So make sure you do that. Now, the next part we're going to do a little differently this week, which is we're going to have a poll question. So we actually have 2 questions. The first one that Mariah is going to launch is your biggest challenge scheduling interview time? We had a lot of people, and I'm getting a start webinar now. I'm getting a cancellation thing on my computer, but I don't know what you're all seeing. But it says, is your biggest challenge scheduling an interview that works for all the team members? So please answer yes or no. And we'll give you about 30 seconds to do that. We did get some feedback that might be a challenge. So when we get to that part in the boot camp, we will really focus. So we're trying to find out, where we should really focus as we move forward. So, all right, is it launched? It's a 50-50. Wow, you guys are good. You make it really hard. So it's 50-50. So we have 50 that, yes, have a hard time scheduling, 50 that don't. It was real interesting. There was a couple points on the discussion board where people did have a challenge scheduling because maybe a person that was going to actually do the interviewing was only available certain days of the week. So that made it very difficult for them. So if anyone has ideas on how to go about changing that, that may help. One of the suggestions that I might put on there is that maybe we could do Zoom or Skype interviews beforehand, so that it doesn't have to be necessarily only on those days of the week. Additionally, someone also said that they had 10,000 square miles to cover and over 30 different facilities. And so that's another thought. Maybe Zoom or Skype type meetings can be helpful. The other thing that someone mentioned is that their CMO always does pre-screening interviews via phone. What a wonderful idea, because that kind of cuts those out that don't make the cut, really, right? And you're not spending time that you actually don't have bringing someone in to do a formal interview. Those pre-interview phone calls can be excellent screening techniques. So be sure those are some of the ideas that I got from the discussion board. So now the second polling question is, have you engaged your board of directors when building a community engagement plan? So we'll give you a few seconds on that. And some of you You know, your board of directors is obviously made up of volunteers from the community in which you serve. So make sure that if you're not engaging them, that they start to begin to be engaged in that process. It's really important that they don't only know that you need a provider, they probably know that from a board report or something, but really, you know, you're enlisting their help. And honestly, if people are asked for help, they usually really kind of take it on and get to work with that. And look at that. You guys are so consistent, it's like scary. It's also 50-50. So again, make sure you're engaging your board of directors. And actually, I would really challenge those that are engaging your board of directors, if you would please put on the discussion board how you actually do that. That would be great, because it would help those other 50% that are not engaging their board of directors. And maybe someone has a good way of doing that and they would appreciate that feedback. So go ahead and use the discussion board on that question. That would be fabulous. And again, it takes just 2 seconds. Don't worry about, you know, if your whole sentence, I know that in HR, we tend to write kind of like we're writing ads, and so we write very short thoughts, and that's okay, just so that someone can maybe get a different idea on how to engage those board members. So now when we look at, and Mariah, my screen is not forwarding here. Okay, now it did. All right, when we look at the recruitment planning process, when we look at these 12 weeks, we have completed some of these steps. And so we've done community and team. That doesn't mean that the discussion can't surround those different areas, right? So make sure to go back and do that if you need to, or call one of us. Today we're going to discuss the priorities in our recruitment plan, the budget, we're going to focus on that a lot, and also a little bit on recruitment firm. And then next week we'll be focusing on advertising and social media. So that'll be a really good session and fun. Just that social media can be a lot of fun. It can also be a huge challenge in the healthcare world. So, and then we'll talk about interviews, contracts, and onboarding, and the important process that is when it comes to keeping and retaining a provider. So that's kind of the outline for the next several weeks. But let's get into what today is about, which is the provider recruitment priorities. And again, look at this very strategically. So look at what are your needs 3 to 5 years from now. And I know some of you are saying, Ann, I have a need that was 3 to 5 years ago, right? I'm still trying to recruit somebody from, 2 years ago. I understand that. But when you're looking at the priorities going forward, obviously the one that you have open, that's been open for the last year, is your priority. But additionally, look out into the future and say, what is changing? And we'll talk about how to determine that. But look at that. What's the challenges that I'm going to have 3 to 5 years from now? What are people retiring? Are they leaving community health? There's obviously not many providers coming out of medical schools right now. So how do we change our practice to meet those needs? So looking out a little bit and really thinking more strategically about it, which is a little bit different than maybe how some of us have functioned for many years, because it was kind of like we have an opening, we got to fill it. We didn't think about necessarily what our needs were going forward. But again, workforce and human resources is changing in that way. We need to do that. We need to look forward. So then the length of time to fill the position. If you look at back and do a little metrics with your HR, with your time to fill, what is it actually taking? So that if if someone is talking about going back to school, or they're moving at the end of the school year because their kids, they want to live in a different community or something like that. Well, this is a perfect opportunity to say, okay, they're leaving in May or June when school gets out. So, it typically takes me, 8 months to a year to fill a position. That means you need to start recruiting right now for that position. So think about that time to fill. Additionally, most providers, when they actually start their jobs, a lot of times it's in that August timeframe because of how people graduate and how people come out of residency programs and things like that. So it's really tough this time of year right now to be finding a provider. You really need to rev up your efforts probably earlier than now. But if now is when you need to figure out your length of time to fill that position. It's important to know. Assess your plan. What is your plan? Has your plan worked in the past? And I hope that, the one thing out of the recruitment boot camp there's several things to take away, but one is to start looking at this as a process. And so if you have positions that need to be filled, how have you done it in the past? What's worked, what hasn't? So start looking at that plan. And that's really important because you don't want to waste your time on what hasn't worked necessarily in the past. You want to just focus on what is truly worked for you. And then anticipate the need. Again, it's that look out, anticipate what the needs are going forward. Now, the next one is the priorities. Mine won't forward again. So the priorities. Again, determine the positions that you need. So talk with your medical director. Are we recruiting family practice? There's not a lot of them out there. Or are we going to change our structure and hire more physician assistants, nurse practitioners, an OBGYN, a pediatrician? What else is out there? So you have to determine what priorities are in your organization. Table 14, which is part of kind of the homework, and I say that in quotes because we hope that you're going through your recruitment plan. But Table 14 will help you determine that. And it has to do with what the position is, what the FTE is, who it's going to replace. Is it a current vacancy, a planned vacancy? Is it retirement? What is the reason for that? Or is it growth? Are we growing? And so have we looked at what type of provider we need for that position? So think about the priorities of the job because the priorities will help you determine where to actually focus. And I know from being in HR, sometimes we look at it, we got to hire everybody. But if you really focus on something, that's more likely to get done. And so kind of prioritize all the openings that you have in your health center. I hate to say it, but you have to prioritize them and focus and go after those that you can win on or that you really need to concentrate on, because if you have a family practice doc that is leaving, if you leave that open for the next year, your revenue that you could have obtained from that person being in place is much greater than if you need a front desk person necessarily at a clinic that already has 4 of them. They might not agree with that, but the reality of there's some positions that are actually more important and prioritized to get filled than others. So now let's go to the recruitment budget. The budget, we all love budgets, right? So this is where you look at what your budget is, and it takes detailed planning. Now, again, don't plan to the nth degree because then we won't have any action. But certainly it takes some planning. So assessment and evaluate that plan and then adjust accordingly. So the next slide, please, is Table 15, which is in your homework. Is that the next one, Mariah? Going? All right. The recruitment budget. So what to include. This is Table 15 that you can complete. And I would really encourage you to do it because it's really important to realize, again, what is the budget that it's going to cost to recruit somebody, because it can be really helpful when you talk to those that are making those decisions, whether you can maybe run ads in certain publications or whether you can use a recruitment firm or how you do that. It's really, what is that budget? So look at your staff costs, right? What are they? The planning, the recruiting, the onboarding. What is the HR salary that goes along and the benefits and how many hours you put into this? Because that can really determine. Maybe it can help you decide that you need to have maybe a part-time person on board, maybe a full-time person that can pay for themselves as a recruiter. Or what is your IT hourly rate, your nurse and MA rates? Because again, if you don't have your provider, your medical assistant is not necessarily being productive. So that's a cost. that you're spending to have that medical assistant not be as productive as they could be had a provider been, if they'd be working side by side with the provider. So think about those staff costs. Then look at outside recruiting expenses. What are the expenses for an outside recruiting firm? And I'll just kind of go through, one of those is your service, your advertising costs. Those are both expensive for national print ads, online services, whatever you're using, those are costs. So that's in table 15. Additionally, the interview expenses. How much is it to bring someone to your center and actually do an interview? So you have hotels, right? You have travel, you have breakfast, you have bringing the partner along or the significant other into the area. Are you including them in the interview process? If you're not, you may want to include that expense. That's huge because a lot of times the partner or significant other wants to see where this other person is looking for a job. So, and then think about your hiring expenses. What are the relocation costs? What is the signing bonus if you have one? What are your publicity costs for the actual job that's open? And any other costs that they have when you hire a new person. So whether it be your EMR licenses, those can run into thousands of dollars. So those are your hiring expenses. So that's your total budget when it comes to recruitment. Can you go to the next slide, please, Mariah? Recruitment firms. We all, sometimes they're necessary, right? So I just want to say a few quick things on recruitment firms because they can be really, really beneficial. With selection of candidates, if people don't have time to do that necessarily at your health center, we tend to like recruitment firms for that, right? They go out and gather all these people and they send the CVs to us and we get to select, but they've already usually done some type of pre-screening. Now, one thing is that if they're not doing a good job pre-screening those people that they're sending to you, make sure that you let them know what your priorities are. And that's been probably the biggest thing that I've seen with recruitment firms. They're trying to do their job out there, but sometimes as a health center, we get so busy and we think, okay, we signed the contract, they're recruiting, we don't have much of a responsibility after that. And the reality of it, if you want that to be really successful for you, you need to partner, again, with that recruitment firm in a lot of ways. And one is let them know what your selection criteria is. Costs. They can either be contingent placement or non-contingent placement. So they're two different things. So just find out if you're using a recruitment firm, which it is. Provide information to them. Again, they can only be as successful as the information that they receive from you. So make sure they have your community demographics, that they have pictures of your health center that they can share, that they have all your benefit information is updated and correct. So think about that. And then additionally, keep in communication constantly with them. And I mean constantly. Probably schedule it on your calendar at least every other week. Speak to them and find out if they're having any success. Remember, they're representing a lot of different places, and you want them to remember you. And then make sure that if they can, invite them, the actual recruitment firm, to come for a site visit and look at your site so that they actually can talk intelligently and with some knowledge and descriptive language when they talk about your community. So those are just some thoughts when it comes to recruitment firms. Now, Mariah, next slide, please. The assignment next week, and we don't want to say it's necessarily the assignment, we really hope that you're completing these tables, and that's table 14, 15, and 16. And that has to do with your priorities, your budget, and then also if you're using your recruiting firm, what that contact information is. But we really do want to encourage you to be on the discussion board questions. And then the additional one is the office hours. Now, this is completely optional. You don't have to participate, but it really is a way to get your questions answered. During that office hours, there is at least two of us, if not all four of us, sharing the phone lines. And so we're all on the phone. And so if you call in and ask a question, you actually get a variety of different insights when answering that question. So I may have a suggestion. Suzanne may have a question or a suggestion too. Allison can have an idea, and Mariah has been doing this long enough also to be able to, tell us kind of all what other ideas that she's got from a different point of view. So it's a really good thing. You can just call the number, hop on. It's a Zoom call, so if you want to show your face, you can. But otherwise, it's just an opportunity to discuss some ideas or challenges that you're having. And I think it was helpful for the people that called in last week. So we just want to let you know we're here every Wednesday from 2 to 3 Eastern time and ready to answer your calls. So with that, next week, Mariah, if you could show the next one, we're going to talk about advertising and also the importance of social media. And yes, social media is very, very important when it comes to your recruitment process. So that's our next webinar, and my gosh, it's already November 1st. So anyway, that's getting close to Thanksgiving, but we're going to have Halloween in there in between, but our next webinar is actually November 1st. So those are the 2 ones we'll do. And then the next one here real quick is what to expect next. And again, we just want to focus on that we're a team, and that comes with not only the 4 of us, we're a team, but we're teaming with the 25 of you. So there's 29 of us in this together, and we want to make sure that you feel like we're really in this together, and that if anybody has any questions, ask, email, call, whatever you want to do. And that doesn't mean just necessarily on Wednesdays between 2 and 3. That can be any time. You can email or call us at any time. Webinar recordings are on the discussion board, which is on the chcworkforce.org website. Additionally, the assignments are incredibly helpful. So we really encourage that if you don't have that time blocked out, block it out every other Wednesday when we have the office hours and work on those assignments if you can. And again, call us if you have questions. So you're done for another week. Congratulations, you have completed week number 5 of the Recruitment Bootcamp. Just really quickly, we'll open it up in case anybody has any questions. We'll give about 2 or 3 minutes to that. If you do, just put it in the chat or raise your hand. Or Mariah, what's the best way to do that? Are you going to unmute the phone lines?
I think it would be best if anybody has any questions to just drop that in the chat box. I realize that we've already run about 4 minutes over our time for the week, so feel free to hop off now. If you do have any burning questions, you can either drop them in the chat or give us a call or shoot us an email. I will be happy to pass your question along to the team here, and we'll give it just about a minute in case anybody wants to chime in.
Okay. If not, we will see you November 1st and or during office hours next Wednesday from 2 to 3 Eastern time.
All right, and I'm not seeing anything come in just now, but you've got our contact information. You know where to find us. I know that because I've been fielding a lot of your emails so far. Look for an email from us tomorrow with the recording of this webinar and some more information about next week. Thank you all so much.
Thank you.